Hello, my name is Heidi Wittenberg. I'm a pelvic reconstructive surgeon in San Francisco who specializes in transgender surgeries. I've been recently asked more and more about peritoneal pull-through procedures, which I think is especially in my wheelhouse for a couple of reasons. One, from a historical perspective, peritoneal pull-throughs were actually created by gynecologists as a form of creating lining for patients that have specific syndromes that they have vaginal agenesis, not unlike my transgender patients. One specific syndrome called Meyer-Rokitansky Custer-Hauser syndrome is a developmental issue where patients have at least a vaginal dimple to start off with, but not the full depth vaginal canal. So then creating that orifice and connecting the abdominal lining or peritoneal lining and dragging it down and connecting it to the dimple was the procedure created by gynecologists. Now, historically, that had been done with an open procedure, and there are a handful of studies of small amounts of numbers of patients that are out there. I think the only study that has more than 5 to 7 patients is one series in India that may have been followed as long as a year. So really no long-term outcomes or data for these patients who have been around for a long time. So we do need to follow patients, whether they are cisgender or transgender, for these specific procedures in order to get data points, outcomes, to be able to adequately consent and counsel patients for this procedure. The other part somebody asked me actually today is why do I think I'm the best surgeon for transgender surgeries, specifically for vaginoplasties? And I responded that I don't necessarily think I'm the best surgeon. There is lots of great surgeons out there. I hope in the future there's going to be a transgender surgeon adequately trained in every location that is needed in the U.S. However, for now, I know we are a rare group and small in numbers. I am, I think, the uniquely trained for this based on my background of being a pelvic reconstructive surgeon for the last 20 years and had been also specializing in minimally invasive surgery, advanced laparoscopic surgery, robotic surgery, had been dealing with pelvic fistulas, scars, trauma, pelvic pain patients, and so have seen the breadth of skill sets that you need for nerves, muscles, ligaments in this area. I had an additional year's training for the nuances, even though I had also done vaginoplasties for cisgender patients, but specifically for the nuances for vaginoplasties in transgender patients. I know that other places are starting to offer peritoneal pull-through, like I am for patients. I know the historical background for most transgender surgeons are they have a plastics background, and then because of that, they have to employ additional surgeons, general surgeons, GYN surgeons, urology surgeons as part of a team to perform peritoneal pull-through. Luckily, based on my background and my training, I have all the skill sets to be the primary surgeon with just an assistant surgeon present to do from start to finish everything needed for that procedure. So, like I said, I am uniquely qualified for this procedure on top of having been trained by reconstructive urologists and reconstructive plastic surgeons on the nuances of transgender vaginoplasties. So that in a nutshell is kind of a historical background, not only for peritoneal pull-throughs, but on my background with peritoneal pull-through procedures. If you have any questions, you can always call for a consult at Mosaic Care.